While some people are more prone to laryngitis, most adults develop the condition once every couple of years. If laryngitis is present longer than 3 weeks, it's considered chronic. Research suggests that about 21% of Americans will develop chronic laryngitis at some point in their lives. In this video, we will talk about this disease, laryngitis, by answering these questions. What is laryngitis? What causes laryngitis? Symptoms of laryngitis, how's it treated? Is it necessary to take antibiotics for laryngitis treatment? What is laryngitis? The larynx, or voice box, is located in the neck and performs several important functions in the body, including swallowing, breathing, and voice production. Sound is produced when the air which passes through the vocal cords causes them to vibrate and create sound waves in the pharynx, nose and mouth. Here is its exact position. Laryngitis happens when the larynx is inflamed. This condition may be short-lived, acute, or long-lasting, chronic. In some cases of laryngitis caused by infection, the infection may spread to other parts of the respiratory tract. What causes laryngitis? There are many reasons causing laryngitis, from overuse, irritation and infection by bacteria or virus. Allergies to things like dust and fumes, acid from your stomach coming up your throat, acid reflux, coughing over a long time, clearing your throat all the time are also causes of laryngitis. If laryngitis lasts more than 3 weeks, it will become chronic laryngitis. Chronic laryngitis can cause vocal cord strain and injuries or growths on the vocal cords, polyps or nodules. Symptoms of laryngitis. The symptoms of laryngitis vary depending on the age. They usually come on suddenly and get worse during the first 3 days. Laryngitis signs can include hoarse voice, sometime cannot speak, cough, sore throat or dry throat, always needing to clear your throat. For children, they may have a fever, feeling not wanting to eat or drink, and rarely have difficulty breathing. How's it treated? Laryngitis can go away on its own after 1 to 2 weeks without treatment. What antibiotic is used for epiglottitis? Empiric coverage for Streptococcus pyogenes, Streptococcus pneumoniae, Staphylococcus aureus, and Haemophilus influenza should be provided. A third-generation cephalosporin or amoxicillin, clavulanic acid, in the management of epiglottitis. Third-generation cephalosporins are preferred as first-line agents because of increasing resistance to antibiotic of choice, DOC, for epiglottitis. This agent is a third-generation cephalosporin with broad-spectrum activity against gram-negative organisms, lower efficacy against gram-positive organisms, and higher efficacy against resistant organisms. Ampicillin with sulbactam is the drug combination of a beta-lactamase inhibitor with ampicillin. This combination interferes with bacterial cell wall synthesis during active replication, causing bactericidal activity against susceptible organisms. Chloramphenicol is used if patients are allergic to penicillin and cephalosporins. This agent binds to the 50S bacterial ribosomal subunits and inhibits bacterial growth by inhibiting protein synthesis. Chloramphenicol is effective against gram-negative and second-generation cephalosporin antibiotic with activity against gram-positive and some gram-negative bacteria, including Haemophilus influenza. Cefuroxime binds to penicillin-binding proteins and inhibits the final transpeptidation step of peptidoglycan synthesis, resulting in cell wall death. Sfotaxime is another third-generation cephalosporin antibiotic with broad-spectrum activity against gram-positive and gram-negative bacteria. This agent binds to penicillin-binding proteins and inhibits the final transpeptidation step of peptidoglycan synthesis, resulting in synthetic antibiotic produced by the 7S chloro substitution of the 7R hydroxyl group of the parent compound lincomycin. This agent inhibits bacterial growth, possibly by blocking dissociation of peptide ltRNA from ribosomes, causing RNA-dependent protein synthesis to arrest. Clindamycin widely distributes in the body, without penetration of the central nervous system. This agent is protein-bound and excreted by the liver and kidneys. Analgesic antipyretics. Analgesic antipyretic agents are helpful in relieving the lethargy, malaise, and fever associated with epiglottitis. Aspirin blocks prostaglandin synthetase action, which, in turn, inhibits prostaglandin synthesis and prevents the formation of platelet-aggregating thromboxane A2. This agent acts on the hypothalamus heat-regulating center to reduce fever, Acetaminophen is the drug of choice, DOC, for treating pain in patients with documented hypersensitivity to aspirin or nonsteroidal anti-inflammatory drugs, NSAIDs, those with upper gastrointestinal disease, or those who take oral anticoagulants. Ibuprofen is usually the drug of choice, DOC, for treating mild to moderate pain, if no contraindications exist. Thank you for listening. That's all the information we want to introduce to you in this video. Do not forget to like, share and subscribe for HE Info channel.